Axe View here. The past two episodes we've been discussing Obamacare. First, we described what it is. Second, we described the problems with it. But now it's time to describe how exactly we can go about fixing it. This is a big deal because Obamacare is on the table in Congress. The Republicans now have complete control along with having Donald Trump as president, so they can make some change here. However, it is important to note some logistical things about legislating. While Republicans control the majorities in both the House and the Senate on their own without the support of any Democrats, they can only really change things that deal with money in the law, like funding the subsidies in the marketplace. To change things that don't deal with money, like coverage for pre-existing conditions, no annual or lifetime caps for coverage, and covering young adults until 26 years old, the Republicans will need the support of at least 8 Democrats to overcome what's known as the Senate filibuster, a requirement to have 60 votes in the Senate to end debate and move on to a floor vote. So it seems like if Obamacare is ever going to change, they're going to need to compromise. As we discussed in the last episode, there's a few things wrong with the original Affordable Care Act, mainly stemming from young people not signing up and a lack of competition in the marketplace. So let's explore the ideas of both Democrats and Republicans to see what the best alternative is to the current law. One idea Democrats have to ensure we get to 100% insurance coverage is to make sure that all other states expand Medicaid. This is obviously not feasible, as remember that the Supreme Court ruled that all states have the option to opt in or out of Medicaid, and Republican states are mostly just not going to do that. As for increasing coverage of middle-income people, we could expand the eligibility limits for subsidies. Doing this could bring more people into the insurance market and help bring down premiums for everyone, as that could mean more young, healthy people sharing the cost of coverage. Additionally, while it may be rational for young people to opt out of health insurance because it's thousands of dollars more than the tax penalty, it might be reasonable for the government to start increasing that tax penalty more to entice people to sign up for coverage, spend more money, but hopefully share the costs and help bring down premiums, and they also benefit by having health insurance. Another idea to save health insurance companies money is to make sure that there is no enrollment outside of enrollment periods so that people don't just sign up when they get sick and then drop their coverage once they're healthy again. Congress could also invest in the insurance bailout fund set up by the law, but that Republicans defunded years ago. This could ensure that more insurance companies stay in the marketplace and help bring that competition to more states. Remember that it is not insurance companies that are the profitable ones in this industry. It is actually the medical device manufacturers and the pharmaceutical companies. So what could we do about them instead? Well, Congress can give the government the power to bargain with pharmaceutical companies for lower drug prices for Medicare and Medicaid, while reinstituting the insurance bailout fund to keep companies solvent and make sure there's competition in the marketplace. We could also create a public option, which is a government insurer that could compete with other insurance companies in the marketplace, lowering premiums and insuring more people overall. Then there's the more radical ideas on the left, like a single-payer option or an all-payer option. Single-payer would eliminate all private insurance and create one giant health insurance company under the government. The theory is that costs would come down extremely because all hospitals, medical device manufacturers, and pharmaceutical companies would have to compete with one entity, the federal government. This is actually what every single other developed nation in the world does for lower cost and better health results. Then there's also an all-payer option, which would keep private insurance existing, but would bundle them together so that they could bargain together against hospitals and compete for one lower price, since the current situation allows a hospital to charge any insurance company a different price than the other. But now there's the Republican options. Instead of getting to 100% health coverage by mandating that everyone get health care, Republicans want to make health care affordable and accessible rather than mandating that everyone get it. In that scenario, healthcare will just be so cheap that everyone will want insurance because they can afford it. While there exists no official Republican plan in Congress yet, there are some ideas floating around. Remember that the most popular ideas in the law are coverage for pre-existing conditions, no annual or lifetime caps, and insurance coverage until 26 years old. So Republicans have to invent a way to pay for all that while still offering affordable health care. As we discussed in the last episode, the most critical and expensive part of the bill is coverage for pre-existing conditions. Before Obamacare, insurance companies could simply deny coverage to people with pre-existing conditions, but Republicans don't want that to happen because that's extremely unpopular. So the idea instead is to create high-risk pools for all people with pre-existing conditions to band together into one insurance pool where the government helps subsidize the cost of health insurance while those people still are buying private insurance. It's important to note that there are only a few percentage of Americans that make up over 60% of all healthcare spending. Those are likely the people with pre-existing conditions and those that are very, very sick. The theory goes that if we remove those very expensive people from the regular insurance market, the premiums can come down for everyone else. This makes a lot of sense, but the disappointing truth is that 36 states before Obamacare was enacted had high-risk pools. They often ended up being underfunded and having to institute wait lists for coverage because they ran out of money. However, Speaker Ryan insists that there will be no caps for coverage and no wait lists in this new high-risk pool instituted by the federal government. It's important to note that before Obamacare passed, 36 of the 50 states in the country had high-risk pools of their own, and premiums were still growing at double to triple the rate as they are today. In order to keep that cost down, those high-risk pools would have to be accessible to all people with pre-existing conditions and not just a few. Another idea Republicans give to make health insurance more affordable is to allow Americans to create a health savings account. That's a bank account that you can store money without having any taxes paid on it. The sad truth is that most Americans just can't afford to save money in the long term like that. This idea would mostly just benefit wealthy Americans that already can afford health insurance, but just wouldn't get taxed on that income anymore. The third idea Republicans have to lower health costs is to create Medicaid state block grants. That would make Medicaid a state-run program rather than a program that's run by the entire federal government. Being run by the federal government, more and more poor people can sign up and the government can go into debt to ensure that those people are covered. But if Medicaid becomes a state-run program where there's a certain allocated amount of money to the fund, the state could run out of money before insuring all poor people. So the lesson here is that there are imperfect ideas on both sides, and it seems like the evidence shows that we should just join the rest of the developed world and completely revolutionize our system to create a single-payer or all-payer system. This would require a massive amount of change to the tax code and to our laws. But we first have to regulate lobbyists and get money out of campaigns so that we can make sure that corruption does not get into government healthcare. In other words, it might be a long time until our healthcare system is perfect. For now, thanks for watching, and keep elevating the conversation.